Does it ever feel like in therapy, there's just a variety of things to talk about and you're like, screw it, let's just spin a wheel? Hello, welcome to my therapy wheel. I'm Dr. Jordan Soper, a board-certified behavioral and cognitive psychologist and an ASEX certified sex therapist. Welcome to Therapy Thursday, where I talk a little bit about some different themes that I've noticed coming up throughout the years of my time working with patients that I feel really passionate about. Because I love little joys in life and I love to be a little creative, I have made you a wheel. So let's spin the therapy wheel and see what pops up. Themes of the week. Let us see what the wheel says. Ooh, GYNO Hell. Yeah, let's talk about gynecological conditions. This is something that comes up a heck of a lot for individuals, especially for individuals who have a number of different gynecological concerns. That can be endometriosis, really rough periods, PCOS, adenomyosis, pelvic pain, penetrative pain. Let's talk about uteruses and how much they can cause a lot of pain for a lot of individuals, but gets so undiagnosed, underdiagnosed, and missed all the time. So one of the reasons that this topic does come up a lot is no one asks about it. Has anyone aside from your gynecologist ever asked you about how your gynecological care is doing? Is it been within the context of reproduction or sexual functioning? Like, whoever is asked, so how's your uterus doing today? Probably not too many people. Welcome to me. I ask all of my patients how and what is their gynecological history. If they are partnered with someone who has a gynecological history, I will ask that too. Your organs are all equally as important. And I know in therapy, we talk a lot about this particular organ, but that particular organ also needs to be discussed as well and being a part of the therapeutic process. In what ways would you describe your gynecological history to a new provider? In what ways would you describe it to yourself? Do you have questions about your gynecological history? Do you want to know more about your anatomy or other people's anatomy? What questions do you have? Do you even know what questions to ask? If the answer is no to many of those things, that is okie dokie. But this is a theme that really comes up a lot in therapy with my patients is I will ask them questions about their gynecological history and they will look at me blankly and I go, ooh, do you want to? And most of them go, yeah. Asking consent, asking to talk about a topic that really doesn't get discussed very often can be super therapeutic, super connecting, and also can be super helpful for the lifetime of a patient and a person, because gynecological conditions are things that really impact someone throughout their lifespan. This is something that can be really difficult for a lot of people to not even know where to go, to not feel heard, to not be certain what the heck is actually going on. There's a reason I have a rainbow speculum sitting here in my office for a reason, to talk about something that can significantly impact sexual functioning, health functioning, mood, emotion, pain. This is something that can really impact a lot of individuals, and even for some individuals cause such a high degree of dysphoria that they would want to rip the sucker out. This is something that is and should be discussed throughout therapy. Let's talk about GYNO Hell together. Feel free to check out. I'm going to include a bunch of resources down below. If you have additional questions, comments, feel free, put them down below, and like, comment, and subscribe. And I'll see you next time.